The urinary bladder is a hollow muscular organ in the pelvis that stores urine produced by the kidneys before it is excreted from the body. Here is a detailed description of its structure, function, and associated processes. Anatomy and structure location. The bladder is situated in the pelvic cavity just behind the pubic bone. In males, it is located in front of the rectum and above the prostate gland. In females, it lies in front of the uterus and upper part of the vagina. Shape and size. The bladder is roughly spherical when full and flattened when empty. It can hold between 300 500 milliliters of urine, though it can stretch to accommodate more. Layers, mucosa, the innermost layer, lined with transitional epithelium that allows the bladder to expand. Submucosa, a layer of connective tissue supporting the mucosa. Muscularis, composed of 3 layers of smooth muscle known as the detrusor muscle, which contracts during urination. Serosa, the outermost layer, which is part of the visceral peritoneum in the upper part of the bladder. Sphincters, internal urethral sphincter, an involuntary sphincter made of smooth muscle located at the junction of the bladder and urethra. External urethral sphincter, a voluntary sphincter made of skeletal muscle located around the urethra. Function urine storage. The primary function of the bladder is to store urine until it can be conveniently excreted. The bladder's walls stretch to accommodate increasing volumes of urine, signaling the brain when it is full. Urination, micturition. When the bladder reaches a certain level of fullness, stretch receptors in the bladder wall trigger the micturition reflex. This reflex involves coordinated contraction of the detrusor muscle and relaxation of the internal urethral sphincter. Voluntary control allows the relaxation of the external urethral sphincter, permitting urine to flow out through the urethra. Associated disorders. Urinary tract infections, UTIs. Infections of the bladder, cystitis, are common and can cause pain, burning during urination, and frequent urination. Overactive bladder. This condition involves sudden involuntary bladder contractions leading to frequent and urgent urination. Bladder stones. Mineral deposits that can form in the bladder, often causing pain, blood in the urine, and difficulty urinating. Bladder cancer, a serious condition where malignant cells form in the tissues of the bladder, leading to symptoms such as blood in the urine, pain, and changes in urination patterns. Incontinence, the loss of bladder control, which can result in involuntary leakage of urine. This can be due to weakened muscles, nerve damage, or other underlying conditions. Diagnostic and treatment procedures. Cystoscopy, a procedure where a cystoscope is inserted through the urethra to visualize the bladder interior. Urinalysis, laboratory testing of urine to detect abnormalities such as infections, blood, or protein. Imaging, techniques such as ultrasound, Connecticut scans, and MRI can be used to visualize the bladder and surrounding structures. Medications and therapies. Depending on the condition, treatments may include antibiotics for infections, antimuscarinics for overactive bladder, surgery for structural problems, or chemotherapy for bladder cancer.